Hi, I'm Dr. Wooten. I'm a board-certified plastic surgeon practicing in Pittsburgh, Pennsylvania, and breast procedures are a large portion of my practice. Today, I would like to explain the difference between traditional breast lift or reduction and breast lift with auto-augmentation. Traditional lift or reduction involves moving the nipple and areola tissue up on the chest wall, removing the skin excess at the bottom of the breast and reshaping the breast to make it shorter, lighter in the case of breast reduction. Things to know when you consider this procedure: scars, sensation, and asymmetries. Scars are unfortunately inevitable, but I sew for a living and I have a lot of tricks to make them the best possible for the patient. The most common scar for this procedure is an anchor scar, and I don't use it because the scar is too long, shows in the cleavage, and then the breast looks flat and boxy and heals slowly at the bottom after this procedure. So what we do is we remove the skin and we place this long scar that goes all the way from here to here and here. So what we end up with a lifted breast, but a very long scar around areola, vertical portion of the scar. So this scar is a very long scar and it's visible in the cleavage and visible on the side of the breast when you wear bathing suit. So I don't like that scar. I don't use it in my practice. There is also another scar. If we just use periareolar scar or a donut scar, what happens is we try to lift the entire breast by just lifting this up here. So we're really not that effective in doing a breast lift because we just lifting the areola up. So we're just taking a little bit of the skin and moving areola up. Not very effective. So I actually don't like this procedure because the scar does not heal well. It becomes wide and it's not effective at lifting the breast. I prefer to use a lollipop incision with this procedure that gives more roundness to the breast with less visible scarring. I make an incision around the areola and then up and down. I remove this skin, remove a little bit of this skin, and then I ended up with a more lifted breast. An incision around the areola and up and down. Good thing about this particular technique, it lifts the breast effectively. Also, it reshapes it, it makes it round. It doesn't flattens this against the chest wall like an anchor scar does, but it does lift the nipple very effectively. The shape is the best and the scar is really minimal. This common procedure does not improve upper breast fullness. So after a year of healing, patients might see more of a ski slope shape to their breast. Gravity wins and the patient might be disappointed at how their breast looks long term. Sensation to the breast. Sensation is an important part of the decision making whether a woman wants to proceed or not. I get often asked if I remove the nipple and place it back on the breast. No, I don't do that. Sensitivity should return to close to normal at 1 year post-op. Asymmetries. Some will be corrected, some will not. And it's important to know about those asymmetries prior to surgery. For the women that come to my practice after they went through several pregnancies and or weight fluctuation and are specifically bothered by deflated look, looking to improve upper breast fullness, auto-augmentation is a perfect solution, especially when they're happy with their current breast volume. I offer breast lift with auto-augmentation procedure. Auto in Greek means self. Auto-augmentation means that I utilize patient's own breast tissue to improve upper breast fullness. It is an additional step that requires extra skill and effort to not just lift the breast, but to create a naturally fuller top of the breast. What I do for auto-augmentation, I separate this tissue and I tunnel it under the breast. So it sits under the breast. So it sits in this position, and this breast just gets reshaped on top of it. And I move the nipple up. So this is how the breast looks after. In 6 to 8 weeks after surgery, the breast tissue settles and patients look more youthful and perky and fuller at the top of their breast. Weight gain will make breasts look fuller. Weight loss will make breasts look smaller. This technique is good for women who are happy with their current breast size and are not interested in breast implants. Fat grafting can be added to improve cleavage, increase size, further improve shape, and correct some asymmetries. Adding absorbable mesh as a bra-like support to the architecturally restructured breast is an effective method to fight gravity. I perform this procedure in accredited outpatient surgery centers with qualified licensed medical professionals. These are not teaching or training facilities. On the day of surgery, I see the patient, mark where I will place the incisions, and review the surgical plan. I perform breast lift and breast reduction under general anesthesia, which means that the patient is fully asleep. This is the safest and the most controlled type of anesthesia. The surgery takes 4 to 5 hours, depending on the patient's specific surgical plan. Recovery may take another hour, and the patient goes home with a caregiver that will be around patient for the next 48 hours. After 1 week, patients should be able to go back to their desk job as long as they keep their days short, rest more, and stay hydrated. The patient should be okay to return to light cardio at 4 weeks and lifting over 5 pounds at 6 weeks and submerging in the water at 3 months. Usually, I see patients at 1 week, 6 weeks, 6 months, and a year. It takes up to a year to achieve full final result when the scars look flat and faded. Sensation is close to normal, and the shape is close to how they're gonna look long term. Thank you for your attention.